You've probably heard the terms heart failure, heart attack, and cardiac arrest. They sound similar. People use them interchangeably sometimes, but they're three different things. Knowing the difference matters. It could help you understand a diagnosis or react in an emergency. Let's break them down. First, heart failure. The name sounds scary. It suggests your heart has stopped. That's not what it means. Heart failure means your heart isn't pumping blood as well as it should. The muscle gets weak or stiff. It can't push enough blood with each beat. This usually happens slowly, over years. High blood pressure is a common cause. Early on, you might not feel anything. Later, symptoms appear. Fatigue, shortness of breath, swelling in your legs or belly. It needs treatment. Medications, lifestyle changes. But it's not immediately life-threatening. People can live with heart failure for years. My uncle lived comfortably for a decade after his diagnosis. It's serious, but not an emergency in the same way. Now, a heart attack. This is different. A heart attack happens when blood flow to the heart muscle gets blocked, usually by a clot in a coronary artery. Those arteries feed your heart oxygen. When they're blocked, the heart muscle starts to die. The blockage often comes from years of cholesterol buildup. High blood pressure contributes. Symptoms include chest pain, arm pain, nausea, sweating. A small heart attack might be survivable without quick treatment. A major one is deadly. Without treatment, you could die within hours or days. A really big heart attack can cause the heart to stop beating entirely. That's cardiac arrest. We'll get to that. The key point, a heart attack is about blood flow to the heart being cut off. It's an acute event. It needs immediate medical attention. Cardiac arrest. This is when the heart stops beating. It stops pumping blood. Full stop. A heart attack can cause it. So can late-stage heart failure. But cardiac arrest can also happen from trauma, like a car crash, or a severe infection, or an electrical problem in the heart. Here's a sobering fact. 98% of the time when someone dies, the official cause is cardiac arrest. The heart has stopped. The other 2% is brain death. Cardiac arrest is deadly within minutes. Without treatment, survival chances drop fast. This is what CPR is for. This is what an AED, a defibrillator, treats. Sometimes the heart is still quivering with electrical activity. But if it's not pumping blood forward, it's still cardiac arrest. It's a medical emergency requiring instant action. Let's recap. Heart failure. The heart muscle is weak. It pumps inefficiently. Chronic condition. Manageable with treatment. Heart attack. Blood flow to the heart is blocked. Acute event. Needs urgent treatment to prevent muscle death. Cardiac arrest. The heart has stopped pumping. It's not moving blood. This is death occurring. Requires immediate CPR and defibrillation to possibly reverse. Why does this matter? If a doctor says your parent has heart failure, you shouldn't panic thinking their heart might stop tonight. They'll likely need medication and monitoring. If someone is having a heart attack, you call 911 immediately. Every minute counts to restore blood flow. If someone collapses and isn't breathing, you assume cardiac arrest. You start CPR and send someone for an AED. Knowing these differences helps you understand medical discussions. It helps you fill out advanced directives accurately. You wouldn't want to refuse all treatment for heart failure because you're thinking of a heart attack. They're not the same. Your heart is a pump. Heart failure means the pump is worn out. It's struggling. A heart attack means the pump's fuel line is clogged. Cardiac arrest means the pump has shut off entirely. Three different problems, three different levels of urgency. Keep that in mind. It could make a real difference someday.